tenderness to the palpation or tenderness to the touch.
Okay.
And what that tells me is that oftentimes, as you've been to a chiropractor before, we kind of touch the spine, we kind of see what's going on, and so oftentimes the tender points are the ones that need to be adjusted. And in your case, unfortunately, to tell you, like, this is a difficult area to adjust often.
Yeah.
Doesn't mean we can't get it. Like, it's usually not that hard, but what can happen is, like, let me get rid of these. The segments in these area, because you're really feeling it, I would say, roughly around these couple vertebrae, which are like the T12, L1, which is the higher up area, which is exactly what you're saying. It's not really the low back, it's not really the upper back or mid back. It's kind of like the mid to lower. This is a transition area. Every time I did every test that I needed to do for this area, pretty much negative, other than like me having you go back or like actually pushing on it. So what I'm thinking is happening is that these facet joints, or these joints right here that actually do the movement of the spine, they bend it forward. These are the joints that it's just getting stuck.
Okay.
You're not having any radiating symptom down the back. Oftentimes in lower back pain, especially if we're talking about sciatica, patients tend to do better when we did that little exam. When I pushed on your back, I said, hey, does that make you feel better? Most of the time it actually feels better.
Okay.
In your case, it's making it feel worse. So what happens is when we extend back...
Well, it wasn't making that feel worse. It made my lower back feel worse.
Yeah.
Okay. Just wanted to clarify.
Yeah.
Okay.
So, but when we go into extension, we are decompressing the disc.
Okay.
When we go into extension, and it increases the pain, typically, not all the time, but typically, it's usually a facet or like an adjustment type of issue.
Okay.
Like where we need to like adjust or align those areas. Well, that's why I'm thinking for you, I'm like, listen, you're not having the symptoms of sciatica, you're not having these other things. Nothing came up positive in that case, which is a good thing.
Yeah.
It doesn't tell me that we need to worry about the disc. So I think like for you, like this is a...
And so you're not worried that it's like a growth or something weird going on?
I mean
you can't really
I can
know.
ask you some other red flag questions, and I will, just to make sure. But at this point in time, two things. One, I don't have x-ray vision to tell you that.
Yeah.
Two, from the red flag questions, I guess I'm gonna ask you in a second. That'll be an issue, but three, I don't really think so.
Okay.
But,
the other thing I forgot to mention, that I don't know if it really made it worse or if it's just like I was correlating the two, but like a few months ago, I had gotten one of those like posture corrector things that I had never used in my life, and I honestly think it made me worse.
Okay, so short term, it might make you feel better. Long term, it's going to make you weaker.
Yeah, no, I honestly feel like it made me so much worse.
Whatever it costs, you're better off buying a bunch of coffee for it, or like buying some wine, or like seriously just...
You don't recommend those
never.
At all? Okay.
The only time I'll recommend a brace is if somebody really needs a certain type of brace. Okay. But the posture brace itself is just going to make you worse in the long run.
That was totally my gut instinct, and like I think I wore it for like...
It's
2
crazy
weeks,
because
and I was like, no, this is awful.
You know how many people like buy it for like $19.99 or whatever it is, and like never return it, and like that places like they've made so much money off of people.
Yeah.
And like if you can't control your own muscles from doing this, then I can't adjust you into a better position.
Right.
I can't do anything. If you're not dieting, not exercising, not doing this, not doing that, not doing that, like an adjustment is not going to like cure diabetes.
Right.
You know what I mean?
And I'm already doing all those things. I have a standing desk. I have the proper thing. I exercise. I eat healthy, so it's like...
So if anything, like I said, you probably should have spent the $20 on wine.
Yeah. Or CBD.
Or whatever you want,